introduce myself first. My name is Lori Steele, and I'm the lead administrator for the SUD voucher. I'll be the one presenting today, and then I have two other team members with us that will also be help controlling chat and allowing people in the lobby. So I think we have something. Okay. Okay. I was just seeing this transcript of me talking, so I was hiding that. Natalie, if you want to go ahead and introduce yourself.
Muted. Hi guys. I have like a really bad lighting situation, so you can only see like part of my face. My name is Natalie. I am one of the administrators for the SUD voucher. So if you end up, becoming a provider, I will be one of the main points of contact for you. I guess I don't really know what else to say. I've been with the division for a couple of years, but I feel like the voucher is my home. This is where my passion is. So yes, I can pass it on.
Angie?
Yep, my name is Angela Niffenegger. I'm an addictions team administrator, and I work with the voucher, and I will be managing the chat with Natalie.
Okay, so it's not going to be a very long presentation. We're probably thinking maybe 15-20 minutes, but if anyone has questions, feel free to throw your question in chat. Unmute yourself, raise your hand, just let us know that you have a question, and then Angie can interrupt me, stop me, and then you'll have an opportunity to ask questions throughout the presentation and then after we're completed. But feel free, it can be pretty informal, so if you have anything that comes up while we're presenting, go ahead and stop us. All right, I am going to share my screen. And so today we're going to be presenting on the Substance Use Disorder Voucher Program. You'll hear us say SUD a lot. That's the acronym for Substance Use Disorder, as you probably already know. So during the 64th legislative session, the Department of Human Services was appropriated funding to administer a voucher system to pay for a substance use disorder treatment program. So a little bit about the program. It was launched in July of 2016. And for the 15-17 biennium, we were appropriated $375,000. In July of 2017, methadone maintenance was added as a covered service, and total expenditures for that biennium was right around $252,000. Moving into the next biennium, 17-19, the voucher was appropriated right under $5 million. We expanded the access for providers to public agencies, which would be excluding the human service centers, but public agencies were allowed to apply. Before that, it was just private agencies. So we did open that up to public agencies in July of 2019. Total expenditures for that biennium was $8.2 million. And so for this last biennium, eligibility was expanded to youth, which would be 14 years of age and older. Before that, it was just 18 years and above. And then in July of 2020, we had to suspend new provider applications and new individual applications due to exhausted appropriations. We were the program was appropriated $7.9 million for this last biennium, and that was expended within the first 18 months of the program opening back up for the beginning of the biennium. So we had to suspend that since the last year, so July of 2020 through July 21, which we opened back up for this biennium. So during that time, the voucher was still able to actually serve, the people that were actively in the voucher program until they were kind of discharged from the program. And then this figure here isn't, oh, excuse me, this figure isn't quite up to date. This is through December, but for the last biennium, total expenditures was 10.3 million. And since it's an exception of the program, we served approximately 4,700 individuals since July of 2016. I'm just going to go through a few program goals that we have for the voucher. Goal 1 is to allow individual to choose provider. So that our objectives would be obviously to increase number of providers, and that's why you're here today, and service options. Service options are communicated to individuals. Program goal 2 would be to improve access to quality services. The objectives would be providers provide evidence-based services based on individual need, and to reduce financial barriers for individuals accessing needed services. Okay, here's where you guys are here, right? How do we become an enrolled SUD voucher provider? So before you even become enrolled and enter into the application process, you must be a licensed substance abuse treatment program and maintain compliance with Chapter 7509-1, which is the general standard for substance use treatment programs. So the first thing you would want to do is complete the provider application, which is SFN 859, which includes the memorandum of agreement. And I'm going to click on the link here, which I'm hoping will take me to where I need to go. Let's see here. Here we go. Okay. So this is listed on our voucher website, which I'll provide the link to you. It's also on our e-forms, but this is the application and the MOA that you would need to complete. It's PDF fillable, so if you open it up, you save it on your computer, you can fill it out online. Number 1 is just like the section 1 is just program information. Section 2 is services requested. So if you're online clicking on this, like there's adult services and adolescent services. So we want to distinguish between the two. If you do a combination of them, you'll want to fill out for each service that you cover or that you provide. So if you want to click here and maybe you do the same for adolescents, if you are filling it out online and you go down to the page 3, it will like auto-populate which services you selected on the page prior, just to let you know that. And you can obviously change these if you kind of made a mistake or something like that. And then here, the attachments, which I'll go into, I'll explain that in a little bit better detail after I get through this. You want to make sure that you attach your policies and procedures that are in accordance with the North Dakota Administrative Code, which is 7509-111-2. And then you also want to include your policy and procedures, identifying that your programming is based on best services, is individualized, trauma-informed, recovery-oriented, and person-centered. And then this number 3 is just these pages 3 through 7 of the application. We'll sign there and date. And here is the program agreement. So I called it MOA, Memorandum of Agreement. This would be considered the MOA. So I'm just going to go through a few of these, like pages 3 through 7 with you. I'm not going to go through it extensively, as you can all review that on your own. But just a few things to point out. Condition D, become a North Dakota Medicaid provider as applicable. We do utilize the voucher as the payer of last resort. And then, so with that, if somebody applies for the voucher and they appear to be eligible for Medicaid, you would want them to apply for Medicaid. So Medicaid, when they're approved, any services not covered by Medicaid can be covered by the voucher. So that's one thing you want to keep in mind. Obviously, assist individuals in applying for Medicaid, which is condition D. Compliance with the most recent updated program guidance, which is also on our website. And ensure all funding sources are exhausted before utilizing the SUD voucher program. Attempt contracted services with all third-party payers utilized by the individual your program serves. So what that is, if an individual applies and there's an exception, or if a person has any insurance, they could still be eligible for the voucher program. You must attempt contracted services with that third-party payer that the individual that you're serving comes to your program. Develop and implement a policy to ensure repayment to the SUD voucher for services reimbursed from other payers. A few other ones, the release of information obviously needs to be between us and the department and the client. These are pretty standard. Submit an auth request, following approved services. These are the same services that are on page 2. Record retention, we're asking for you to hold on to for a period at least 7 years from the end of the fiscal year. Random audits by the department. Submit in writing to the department within 5 business days when an individual's eligibility status has changed. Collect and submit process outcome measures as prescribed by the department, training technical assistance. And then the rest of these are pretty standard contract language. I'm not going to go through any of these, but it does go through, you'll just have to add your provider information here. Basically telling us that any notices and communication where you want them to be sent to, which would be your information. And the bottom here, I'm going to move this over. And then the left side here is where the department signs. So you'd want to put your provider name here, sign and date, and then you submit your program application, the program agreement, and then the attachments to the SUD voucher at indy.gov email, or you can also fax to our number. Okay. Get back to
So there was a question in the chat. It's been answered already, but Amanda asked if any of the other medication, the MAT medications are covered by the voucher. And right now, methadone is the only one that's covered. So anybody else had any questions on that? Or does anybody else have any questions? You can either raise your hand or type it into chat.
Good time to pause, yes, for questions, definitely.
So far, nothing.
Nothing?
Going once, going twice.
Mm-hmm.
Okay. All right, I'll let you continue, Lori.
Okay. And so I'm just going to go through. So a part of the attachment on the application, the SFN 859, in that section 2, I believe it was the attachment section, has to align with our North Dakota Administrative Code, which is the 7509-11102. So I'm going to go through those with you to make sure that you incorporate those into your voucher policy and procedures when you're submitting your application. Okay. Everybody read this okay? Is it too small? Is it okay? Okay. Okay, so you'll want to review 7509-111-02. And this is your application basically to participate in the SUD voucher system. Assigned application, which is the SFN 859, assigned agreement, which is also that, and then receipt of your program's policies. So it's 3A through K that we're looking for when we're reviewing your application and your policy and procedures. So obviously, ensuring compliance with 7509-101, that's the general standards. For substance abuse treatment programs, you want to review that. which I have pulled up here. You could be aware of it already, you may not be, but this is the general standards for the substance abuse treatment programs, because you have to be a licensed program in order to be a voucher provider. This basically goes through a lot of sections here. I'm not going to go through those with you all, but keep that in mind. Oh, sorry, I'm losing track. Oopsie. Let me go back here. Sorry about that. Okay, let me scroll down again to 11102. Ensure that you use a screening tool basically to determine individuals' need for further assessment of SUD. Ensure screening is completed to determine financial eligibility consistent with the individual eligibility criteria. Subsection 6 of this is 1107. Go down to this one. Which is right here, which we'll get into again. It's just the individual eligibility. I'll get into that in just a minute. Okay, defining the specific ASAM level of care, services provided by your program, ensuring that only appropriately licensed or certified staff are providing this specific level of care. Make sure that you identify services based on best practices, including individualized, trauma-informed, recovery-oriented, and person-centered programming for reimbursement through the SUD system. Again, this is in some of this is in the actual SFN 859 and the agreement. Define specific procedures to ensure reporting of process measures and outcomes. Defining and developing specific procedures for timely and accurate billing. Defining procedures allowing the department DHS to access the records. Ensure participation and training are consistent with our department requirements. And then making sure the individual completes the individual application through the portal system. Does that bring up any questions for anybody? Not seeing any. Okay, I'll move on. The individual eligibility requirements for the SUD voucher. The individual is at least 14 years old. The individual is currently a North Dakota resident. The individual lacks resources to cover cost of treatment. And the individual's federal poverty level is below 200%. If a person is over the 200% FPL, they can still be eligible based on an exception request. They can submit financial hardship and still be able to be approved. And those are reviewed on a case-by-case basis. Okay, I went through this briefly in the SFN 859, but I'll just go through it again. The covered services are assessment, screening, individual group family therapy, your analysis, peer support or recovery coaching, transportation, methadone maintenance, and room and board. Okay, I'm going to go through a few of the last session's updates, legislative session updates that specifically affected the SUD voucher program. Effective next July 1 of 2022, out-of-state licensed substance abuse treatment programs located within a bordering state may participate in the voucher program to an underserved area of this state. They'll need to complete an assessment of need, and reimbursement is only for outpatient and community-based services. Another update that affected the SUD voucher was we were appropriated $15 million this biennium, 21 to 23. So it'd be July 1 of 21 through June 30th of 23. No more than 45% of the appropriate amount may be allocated for residential substance use disorder administered by, they're called an IMD program. So it's a program that has a residential program that has more than 16 beds. And then the next one is we do have a moratorium for new IMD programs. So the voucher program was instructed, we're no longer able to accept new IMD programs, basically residential treatment programs that have 16 beds or more that were added after July 1 of 2020. And we also were distributed up to $4 million in grants. So a licensed substance abuse treatment program that excluding the regional human service centers and hospitals or medical clinic-based programs may apply for a competitive SUD voucher grant. This is up to 5 programs. And this is a one-time grant award for a term of 5 years. And the grant funds must be used for a program of fewer than 17 beds, so not an IMD, in an underserved area as determined by the department. Any questions for anybody on that? I can't see chat, so. Okay.
I couldn't find my unmute button, but no, doesn't look like there's any
Okay, thanks,
questions
Natalie.
right now.
Okay, so I want to touch base a little bit on what we use. Once you do become approved for an SUD voucher, a provider, we use what's called the provider portal system, or what you'll hear us say as PPS. Once you're approved, you'll receive documentation and like a training doc on how to access the provider portal system. And then we have another training document on how to utilize it. But the PPS is utilized to submit and track all aspects of the individual's voucher activity, including individual applications, releases of information, prior authorization requests, invoices, and outcome measures. So just a few points with the PPS. Each program must have an ND login account to access it. So you might already be registered with the North Dakota Secretary of State. So if you are, you can use that SOS account or create a unique login to access the PPS. It's completely up to you how you want to handle that. And each user can register for an ND login account to access the PPS. And what that means is if you have multiple people submitting, helping with the voucher, say the program has an ND login account, you can have 3 people register on their own for their own ND login account. And once they access the PPS, we will know which person is submitting the releases or the applications or the auth request, just so if we have questions, we can contact that person. And then the system does some auto generation for notification. So that person who submitted that information will get notified by the PPS. Okay, well, my last slide is a couple, I guess, is just like some website links that, so here's the link to the individual application if a person needs to apply. It's also on our website. This is the ND login account registration, where you would go to register for an ND login account to access the PPS. And then the provider portal this is the direct link to the provider portal once you become approved and you have access and you have an account. This is the link to basically access the provider portal to do all your work. And then the SUD voucher program website, which I'll take you to right now. Basically all the information that I presented today is on our website, and it's under provider guidance. Here's the provider app and MOA, so the SFN 859 in the agreement. And then here's the provider program guidance. And then we did some training early back in July of this year how to access and how to track everything in the system and how you do all of your submissions. They're all right here. Under provider resources, there is a few things under here that you want to probably pay attention to. We use the SFN 1059. And so this is the release of information that you can upload to your computer. And then once you get access to the portal, you would link that ROI, submit the ROI, and then you can do your work with the individual. All right, and then if anybody has any questions for us, you want to raise your hand, throw it in chat, unmute yourself, feel free. If you think of something later, feel free. We can throw our email in chat.
I was just doing that.
Okay, you're on the ball, Natalie. I'm gonna switch. Maybe I shouldn't have had it in the morning. Maybe I should do the afternoon. You guys maybe would be a little more chatty. Are we still? That's completely fine.
Yeah, if you guys think of anything, or if you even come into contact with somebody else. Oh, we do have one question. But you can always email that address I put in the chat, or give that to somebody else too if you know somebody else has interest in becoming a provider. And then Matt has his hand up. You want to unmute yourself, Matt?
Yeah, hi, how are you? I'm sorry, I got to the meeting a little late. Can you just clarify something for me? If someone is in order to use the voucher, if someone has Medicaid currently, would they would have to use Medicaid first before using the voucher?
Right.
Yep.
So, and wouldn't everyone who has the financial need qualify for Medicaid?
So the SUD voucher program has their eligibility requirement, or our eligibility requirement is it's 200% or less to qualify, unless there's an exception calculation. Hopefully I'm answering this question the right way, or how you're asking it.
Yeah.
Medicaid is, obviously 100%. Expansion is like 128%, I believe. So initially the voucher was intended to catch that gap of people who make too much for Medicaid, but make underneath that 200%. There's also the exception requests, like if somebody, there is a potential for earning some amount over that 200%, and it goes by a case-by-case basis. When there's an extenuating circumstance, like too high of an out-of-pocket maximum, or qualifies for Medicaid, but in the interim between applying needs services,
Okay.
so on and so forth. So there are exceptions to that.
Yeah, that makes sense. The 200. How many people, do you guys know how many people fall between the 100 and 200? Do you have numbers on that?
We don't, not off the top of our heads. I mean, I'm sure we could probably have our, data analysts look into it, but we're not sure exactly. Yeah.
Okay. Yep. And
also a comment too, like the voucher, thanks Lucretia, the SUD voucher also covers more services of Medicaid and Medicaid expansion.
Okay.
So there might be some services that Medicaid won't cover if the person is still approved under the voucher that we could cover for them.
And what is the logic behind the IMD exception? Like what is the logic behind that? Meaning IMD, not the IMD exception, like excluding our facility specifically from participating in a SUD voucher program versus, say, another IMD that's already in existence.
That was essentially implemented in this last legislative session, and I think that came more to, an IMD can't bill to Medicaid, and so it's kind of like to mitigate the use of our funds, so that an IMD, or that the IMDs that can't bill anywhere else and have to bill to the voucher, are not, essentially absorbing all of our funding and leaving all these other providers that we have falling behind.
No,
I see
I
Lucretia's
get
typing
that.
right now. She probably has a better idea because she actually goes into legislative session and goes to battle for us.
I mean, I guess I'm trying to understand how, like, why it's okay for one, why it's appropriate for one IMD, but not appropriate for another IMD. Shouldn't it be appropriate or not appropriate for all IMDs?
So like Lucretia just put into the chat, that decision was up to the legislators. We had IMDs, the moratorium on IMDs came, it said that no new, so these ones had been on, they were grandfathered in, like they had already been utilizing the voucher for several years, and legislators said, okay, stop, like we're not gonna let any more IMDs on. These ones, we couldn't take away their, in mid-time, their license or their contract with us, so they were grandfathered in, essentially, is what happened.
So the IMDs that abuse the system are the ones that are allowed to stay, but the ones that didn't abuse the system aren't allowed to come in? Is that accurate?
We couldn't comment on that, Matt. This is Angie.
Hey.
But one of the things is something like this is just up to the legislators during the legislative session. So we would encourage you to reach out to your legislator and continue the discussion there. That's kind of the best start for change.
Okay. Yeah, we've been trying. Believe me, we've been trying.
Yeah.
I just thought, like, from a logic point of view, I just try to understand, like, the logic behind it. It's like, it just doesn't make sense, but it is what it is, I guess. And I guess my confusion was, because I know part of the problem was, even though someone had Medicaid, they were getting billed under the voucher system previously. Now it seems like the pendulum has swung in the other direction, so that we were, the facilities in general were overbilling SUD because they weren't billing Medicaid, from my understanding, because SUD paid faster. So they would take a Medicaid person and populate it with a SUD voucher where they should have billed Medicaid. But by removing that, which was a smart move, I agree. Why have a SUD voucher for someone who has Medicaid coverage? But then I think what happens is the population that you're servicing gets dramatically reduced because you're only covering basically the 128. That's 70% population that fall between the 128 and the 200, which I think overall the population in North Dakota, if I did my math using Kaiser Foundation numbers, I don't even think would use up the funds ultimately, because there's such that little gap is such a small amount of population for the amount of funding that was allocated towards it. So I'm wondering what happens if those funds don't get utilized at a certain period. Does it get readdressed towards something else? Is there legislature that addresses the unused portions?
So I can answer this question. This is Lucretia. Hi,
Hey, Lucretia, how are you?
I'm good. It's good to hear from you. So for those who don't know me, I am a manager at Behavioral Health Division of Addiction Program and Policy. And to answer part of your question is, each quarter we are required to report into the budget committee for legislators. So they are watching that to identify what, if there's going to be leftover funding, then it would be their conversations on what to do with that additional funding. So that's where that's at the moment. I do also want to say that yes, the STD voucher was created to bridge that gap for individuals that would qualify for Medicaid to get services quicker. And so they could go into the programs would be reimbursed, and then the individual would get on Medicaid, and then programs reimbursed us.
Oh,
so I don't know if you're aware of that, but we did.
No, I wasn't. Thank you for that.
Yes, it is a requirement, and programs did reimburse us. And we have a process in place of where we track that. And if you were involved, if you recall last legislative session, we did receive a, the Department of Human Services received a FTE, a full-time position, and for an individual to assist SUD voucher eligible individuals to get on Medicaid. And so she has started now. She also assists in the tracking of who is eligible and who is signed up and how is that process working. So yeah, there definitely some forward movement, but yes, we have received reimbursements from several providers once individuals are on Medicaid or and yeah, does that answer?
That's very helpful. I appreciate that. That explains a lot. That's all I have for a moment. Thank you. Thanks for this was very informative.
Great.
Thank you.
Any other questions from anybody?
If not, well, I thank everybody for coming today. And if you don't think of something right now, you can always send us an email and we'll answer. If we don't know the answer, we'll find the answer for you and get back to you as soon as we can. Thanks, everybody.
Thanks, guys.
Thank you.
Have a good day.